Hi everyone, so I told you I was going to do a what do I know segment. I did the introduction and I just wanted to put that out there of what these videos were going to be about and what the content was going to be about. And I think the thing that I missed off on that is just to say that I did procrastinate, and I kept saying this is what I'm going to do, this is what I'm going to do, like this is what I want to do, and putting it off. And I wasn't putting it off because I don't want to do it, because it's something I'm really passionate about. That you'll see in the videos as we go along, that I just talk about a subject and I can talk and talk and talk, and I might go off onto tangents of other things. So you'll just have to be patient and keep up with me. But yeah, it wasn't. I wasn't procrastinating because I didn't want to do it. I was procrastinating because I wanted it to be right. Yeah, yeah. I wanted to just be right and to come from a place of honesty and truth. So yeah, like I was saying, there's many different reasons why I wanted to do these videos. Like I say, we had a family thing that made me think about my dad. And the fact that I can never hear my dad's voice again. Like I said on the introduction video, we've only got pictures and our own memories of our dad. So yeah, I think it'd just be nice for the kids to have something. But also, so to start off, this is what do I know? I had my eldest daughter when I was 26 years old, and I remember changing her nappy, and I was like, "What is this white stuff in a vagina?" And someone had to say to me, "It's normal, like it's normal for your vagina to have discharge. It's sort of like the air. So the air produces earwax, and we clean out the earwax, but the earwax is what keeps your ear clean. So it's the same with discharge. So, like I did say in the introduction video, viewer discretion is advised. But it's honest, and I want to break down walls and taboo subjects, especially surrounding women. Like I say, I'm coming from I am a woman. I'm raising 3 daughters, and a lot of subjects around women are taboo. I was talking to someone the other day about miscarriage, and we were saying it happens more often than you realise. It's just something that people don't want to talk about, whether it makes them feel uncomfortable, or whether we're uncomfortable talking about it. However, I'm going off on a tangent here. When we lost our daughter, so I was 5 months pregnant, we went for a scan and got told there was no heartbeat. I will touch on this more, but for context, my eldest had a picture of the baby on a phone. So when you go to the hospital, they take pictures, they give you a memory box with all little things in and the pictures in. So my eldest had a picture of our daughter Sophia on her phone, and it made other people feel uncomfortable. And I was a little bit like, oh, maybe you shouldn't have it on your phone. But then I was like, it's her phone, and if she's comfortable looking at a picture of her baby sister, then that's on her, and it's not for other people. If other people are uncomfortable about it, that's on them. It's not on her to make them feel comfortable. So it's not on me to make other people feel comfortable. I'm comfortable talking about these things, as my children will tell you, because I just think it's important. I was 26 years old, and I'd always thought, like, what's happening to me? And like I say, I grew up with my mum. I couldn't even, now my mum's 66 years old, and I couldn't tell you an insecurity she had when we were growing up. And I know she would have had them. I know she would have, but she was just so open and so free in her body. And my mum was a big woman. I say was because she's not anymore. She's lost loads of weight. But yeah, she just never showed her insecurity, and we were quite open. But even, like I say, at the age of 26, I didn't realise that discharge from your vagina was normal. And it's just a way of keeping your vagina clean, basically, and killing off bacteria. It's also the same as pubic hair has a purpose. Pubic hair is to stop sweat going into your vagina and putting bacteria there. So yeah, I didn't learn that till I was 26 years old. That's something that naturally happens. Again, I think had the conversation once with my sister about ovulating, and she was like, do you not know when you ovulate? And she said, again, you'll have a different discharge. So when you ovulate, which is when your body is releasing the egg to get pregnant, they tend to say is 2 weeks before your period or 2 weeks after a period. So it's when your body's getting ready to release an egg and you have discharge then, and it's a different discharge. So it's not the white discharge, it's more like for some women, a snotty discharge that's got a purpose, so that if you do have sexual intercourse with a man, that sticky discharge helps the sperm travel or stay in the cervix to impregnate the egg. So it has a purpose. So I remember having this conversation with my sister, and I was like, yeah, but again, I didn't know whether it was just me that happened to. I didn't know if it was other women. And it wasn't until you break down these walls and I started having conversations about it that we realised that it's a normal process. These things are, and I'm saying normal. And like I said in the instruction, you have to find what's normal for you. So you notice changes. And as well, I'm breaking down these walls, not just because I think it's necessary, but because it's so important that you learn what's normal for you. They say this all the time when you're checking your breast for breast cancer. You have to establish what's normal for you. So what feels lumpy, I'm going off on a tangent, felt a lump once. Again, apparently your boobs are more lumpy before a period, so it's best to check your boobs after you've finished menstruating, because they can feel bumpy. Again, I ended up having to go for a scan because I went to the doctors, they felt the lump there. And it just turns out I do have very lumpy boobs, apparently. It's something that's always baffled me, actually, checking your boobs, because I'm always like, my boobs feel dead lumpy. Is this not what they're supposed to feel like? But again, the doctor said it's finding what's normal for you. I went and had the scan, and again, it just turns out it was fatty tissue, because that's what your boobs are, fatty tissue. But it's breaking down these walls, discussing them for health reasons. So it's learning what is normal for your vaginal discharge. So I tend to know now when I am due on, because when I am ovulating, because of the discharge difference. And I think it's really, really important as well to, with the discharge, it's cleaning your vagina, but you have to clean that away so there's no build-up of the discharge actually in your vagina. But it's then important to not be using perfumes, and because that just comes along with a whole other bringing bacteria and infections, thrush, BV, bacterial vaginosis, 2 things you can get. If you make your pH balance different in your vagina than what it's supposed to be, that's what gives you the thrush and the bacterial vaginosis. So yeah, it's just important that you just clean it with water. And like I say, just get to know what's normal for you. It's normal to have discharge. It's just your vagina cleaning itself. It's also normal to have discharge if you are of an age where you have periods. Usually 2 weeks before your period, you will start to ovulate. Your discharge will change, and it's just a different discharge, because of the time of the month that it is. So yeah, that's your first what do I know. That's what I know on vaginal discharge. I hope you all found it useful. And I'll see you in the next one. Bye.